Good afternoon, Mr. Chair and members. Today I have the pleasure of presenting AB 216, which established the Pupil and Staff Safety Pilot Program to provide school staffing training on alternatives to physical restraint and seclusion of students and de-escalation strategies. I want to thank the chair and the committee for all their work with this bill, and we obviously are pleased with the way it has come out, and so we appreciate the recommendations. Too often, students with most significant disabilities, such as autism and emotional disturbance, are placed into dangerous and inappropriate restraints and seclusions throughout California. Currently, 12 states ban seclusion of all students, while 18 do so with students with disability alone. 19 states protect all students, limiting the use of restraints to instances of immediate threat of physical danger. California has fallen behind federal guidelines and practices adopted by other states to reduce the use of these dangerous practices and instead implement positive behavior techniques. As a part of a statewide effort to restrict the use of restraints and seclusion, along with Governor Newsom's commitment to providing safer and more inclusive classrooms, California school staff needs to be properly trained on de-escalation techniques to achieve these goals. AB 2016 is a follow-up bill to AB 2657, which prohibited restraints and seclusion in schools unless the student's behavior presents an immediate danger of serious harm to the students or others. Providing training for these situations will help prevent situations as the one in El Dorado County and countless others across the state. AB 2016 establishes the Pupil and Staff Safety Pilot Program administered by the existing Scale Up MTSS statewide project in consultation with the California Department of Education. This program will award grants to local educational agencies for the purpose of training school staff on alternatives to seclusion and restraint and safer de-escalation techniques. This bill is sponsored by Disability Rights California and is supported by the Alliance for Boys and Men of Color, Educate, Advocate, and others. Here to speak in support and to offer technical questions on AB 216 is Gregory Kramer from Disability Rights California and Malara Erickson Tamino of Port View Preparatory School. Okay.
Thank you, Mr. Chair and members. Gregory Kramer on behalf of Disability Rights California. I'd like to thank the author, her staff, and the committee staff for working with us on developing the proposal that you have today. This pilot program will award grants to LEAs for the purpose of training school staff on alternatives to seclusion and restraint, building off of Assemblymember Weber's previous efforts. And like Dr. Weber, Disability Rights California has fought for years to curb the use of seclusion and restraint tactics and techniques, and we believe that training on de-escalation techniques is a practical next step to protect the health of pupils and staff and to provide for a better prepared workforce. And as reflected in the analysis, pupils with disabilities are disproportionately subjected to restraints and seclusion. According to the United States Department of Education, a report they released in 2014, pupils with disabilities represented only 12% of the national student population, but accounted for 58% of those placed in seclusion and 75% of those subjected to physical restraint. The Department of Education also found that physical restraints and seclusion were disproportionately used for Black pupils across the country, regardless of their geographic location, school, or economic status. Currently, California does not offer standardized trainings to prevent the restraint and seclusion of students by emphasizing de-escalation techniques, and so accordingly, school districts have developed practices to prevent restraint and seclusion and or have been legally compelled to. With the establishment of the SUMS initiative in 2015, the state took a focused approach to integrate positive behavioral supports in California classrooms, and we're also heartened by the efforts by the Department of Education to provide guidance on Dr. Weber's previous legislation. Meanwhile, the federal government continues to advance reforms to use restraints and seclusions, and the state must be prepared to follow suit. Last year, Secretary of Education Betsy DeVos announced an initiative to examine the inappropriate use of restraint and seclusion in our nation's schools. And additionally, several states have taken action to reform their own internal restraint and seclusion policies. So the lack of de-escalation training has resulted in preventable student deaths, injuries, and trauma, along with physical harm and criminal charges for school staff and class action lawsuits against numerous counties of education. California could avoid these tragedies and liabilities by offering proper training and de-escalation techniques, and for those reasons, we're proud to sponsor the bill and ask for your support.
Thank you. Next witness. Assembly members, I am Dr. Melora Erickson-Tomeno, and I am a board-certified behavior analyst, licensed psychologist, and doctor of developmental psychology. I have the privilege of serving students, kindergarten through 22 years of age, with intellectual and developmental disabilities as one of the founders and principals of Portview Preparatory, a non-public school with campuses in Orange and San Bernardino counties. We have consulted with and audited various districts across the state of California, specifically examining their behavior intervention practices. During these observations, the consistent theme is lack of resources and training for those serving students with behavioral and emotional challenges. It is for this reason we are asking that you support and pass AB 216. AB 216 specifically targets this gap in training by providing local educational agencies the opportunity to apply for grant funding to support training efforts. The post-training result will be empowered educators who are able to provide proactive intervention, reducing the likelihood of student injury or trauma. During the last 6 months, we have trained over 170 educators and support personnel and found that there's a large discrepancy in what our educators think they know and what they need to know to best serve their students. Through pre- and post-training surveys and collection of anecdotal data, we have found that while educators want to learn and have a large desire to help their students with challenging behavior, they lack the training and resources to do so. For example, results from a needs assessment survey conducted with these 170 educators indicated that while 94.68% of respondents were exposed to and had to participate in de-escalation of challenging behaviors, only 37.06% of them felt that they possessed the knowledge to manage these behaviors in a school setting. Following training, educators shared that they were able to develop more effective behavior intervention plans and reduce challenging behaviors quickly within their classroom. With your support of this bill, we can give educators the training that they need to serve students with challenging behavior so that they do not find themselves without the necessary tools to educate and keep their students safe. Thank you.
Thank you. Others in support?
Good afternoon, Chairman and committee members. Kaylin Dean with the Alliance for Boys and Men of Color at PolicyLink. Strong support.
Hello, I'm Wendy Keaty, and I'm here on behalf of both Educate Advocate and Empower Family California in strong support of AB 216. Thank you.
Sandra Barrero on behalf of the California School Employees Association. We haven't taken an official position yet, but are likely to support. Thanks.
Thank you. Seeing no further support, any opposition? Seeing no opposition, we'll bring it back to the committee. Thank you, Dr. Weber, for the bill. I think any time we can train people on a school site as to how best to deal with children is a good thing. And that's, I think, your overarching goal here. With that, Ms. Smith.
I'd like to thank my colleague from San Diego for bringing this measure forward. I had the privilege last fall of visiting a non-public school private placement setting for some of my region's most challenged, emotionally disturbed children. And what was impressive to me is the extent to which the staff was really embracing not only the latest in research-developed techniques, but had actually employed their own researchers in the field of both kinesiology and engineering in terms of developing safe physical redirection, and then had completely revamped their concept of seclusion, and it really became more about teaching and empowering these children with the techniques to learn to de-escalate themselves. And I think that really ultimately as educators, that's what the goal is for all of us. So I thank you very much for this very timely measure and plan to support your bill today.
Thank you. Seeing no further comments from any of the committee members, you may close.
I respectfully ask for your aye vote for AB 216.
Do we have a motion on this? It's been moved and seconded. The motion is due pass to appropriations. Secretary may call the roll, please.
File item 2, AB 216. The motion is due pass to appropriations. O'Donnell?
Aye.
O'Donnell, aye. Kiley?
Aye.
Kiley, aye. Daly? Daly, aye. Kalra? McCarty? McCarty, aye. Smith? Smith, aye. Weber? Weber, aye.
The bill is out with 6 votes. Thank you.